Hi, it's Christina with the Sisyphean Journal. Today is March 8th. I already did 3 videos to cover 4 deaths today, and I'll link to those below. One is 2 women who traveled to New York to take advantage of the new abortion utopia that was ushered in ahead of Roe versus Wade. Another one was actually a criminal abortion death, and the evidence is that she had been pretty successfully arranging illegal abortions and had every reason to think that this one was going to be successful and not kill her. And another one where a teenage girl died after an abortionist in Washington, D.C. Sent her home. He was deliberately doing incomplete abortions so that he could charge medical assistants more for aftercare. So you follow the links below and there'll be information about those cases. But what I want to look at today, this is a little post that Life News posted on X from PubMed Central. Fetal surgery. Fetal analgesia, that's pain relief, is routinely given before open or fetoscopic surgeries after mid-gestation to prevent pain in the fetus and avoid deleterious short and long-term effects of exposure to painful stimuli. Ethical and medical concerns have resulted in a slow shift in the use of analgesia to earlier gestational ages. Anesthesia recommendations published in 2021 recommend the use of analgesia, that is pain control medication for the fetus, from second trimester onwards, 14 plus weeks of gestation, or whenever invasive procedures are performed on the fetus, while researchers suggest consideration of pain management from 12 weeks of gestation. That is not just to control the amount of pain, but because if you're not intending to kill the baby, that pain causes long-term problems. So, so much for the formless blob of tissue smaller than a grain of rice. If they are trying to save this baby, they have to give the baby pain medication to perform any kind of medical procedures on it. But it's a good and beautiful and worthwhile thing to reach in with a pair of forceps and just start ripping pieces off that baby with no anesthesia. Anybody who tries to claim that aborting these babies is a good and beautiful thing is either abysmally ignorant or they are an absolute monster. There is no excuse for what is done when they kill these children.